Hi, my name's Dr. Cath White. I'm the Medical Director for the Institute for Addressing Strangulation. The immediate symptoms that somebody might have when they're being strangled is confusion, pain, fear. They might have difficulty breathing, they might have pain on breathing, they might have difficulty speaking. Differences with their eyesight, so they might have see stars, they might have flashing lights, they might notice that the vision has blurred, or they might have even lost any vision. They also might notice differences with the hearing, so they might notice a buzzing noise in their ears or a roaring noise in their ears. So immediately afterwards, people might again complain of pain in the neck, difficulty breathing, difficulty swallowing, pain on swallowing and actually difficulty swallowing. They might have headaches, they might feel sick, they might have swelling in the neck, they might notice bruising, so that could be bruising, say from the fingertip grips of the attacker. It might be scratches, and that might be from the attacker's fingernails or from their own fingernails as they try to remove the grip of this person from their neck. They might notice that their voice is more husky or that it's deeper than it usually is. That would usually last just a couple of days. They might notice a cough, they might feel sick, they might have a headache, general confusion, and that's quite common, the confusion, and that's because their brain has been starved of oxygen. So it's not surprising that they might feel a little bit confused. No oxygen equals no memory. If we're talking about physical symptoms, there might be symptoms associated with traumatic brain injury. So people might have problems concentrating, problems processing information. They might have problems with asymmetry of the face, so the muscles on one side of the face might be different to the other side. Big issue would be psychological problems, and that's completely understandable. It's a very normal reaction to have symptoms after that. So that might be anxiety, it might be depression, it might be hypervigilance, so a feeling that something bad is about to happen. They might have flashbacks, they might have nightmares. So these are normal reactions to what has happened to them. First of all, the person themselves might not realise that they've been strangled, and that is because when the brain is starved of oxygen, it doesn't create new memories. If they do recall that they've been strangled and they report that, as a clinician we would take a history, we would examine them, but 50% will have no external sign of injury. And that doesn't mean that they haven't been strangled. It doesn't mean that the strangulation they've experienced is less severe than if they did have injuries. So we would still take it seriously if somebody reported that.